دكتور محمود. دكتور محمود عبد الرحمن.
نعم، السلام عليكم.
عليكم السلام ورحمة الله وبركاته. لو سمحت حضرتك تفتتح اللقاء. الدكتور عبد المحسن موجود بره.
طيب، بسم الله، الحمد لله، والصلاة والسلام على رسول الله. نرحب بجميع الحضور، كما نشكر سعادة الأستاذ الدكتور عبد المحسن زلباني وفريق التدريب لهذا البرنامج المتميز للمرة السابعة في المملكة بترخيص مزدوج بين هيئة التخصصات والجمعية العالمية. نتمنى من الله سبحانه وتعالى أن ينفع به، ونتمنى أن نكون جميعا حصنا لشبابنا وعلاجا للمبتلين بتعاطي أي نوع من أنواع التبغ نحو مجتمع بلا تدخين ولا مخدرات بإذن الله سبحانه وتعالى. طبعا فريق البرنامج غني عن التعريف، فريق متميز، أعضاء التدريس ومختصين لهم باع طويل في هذا المجال. يشرفنا أن يبدأ في هذا الكورس سعادة الأستاذ الدكتور عبد المحسن الزلباني، وهو أستاذ ورئيس قسم طب الأسرة والمجتمع بكلية الطب جامعة طيبة. الأستاذ الدكتور عبد المحسن الزلباني له عدة أبحاث، وهو أحد الباحثين المتميزين الموجودين على شبكة ستانفورد كعلماء نتاجهم البحثي ونتاجهم الاستشهادي من أعلى الأرقام على مستوى العالم. نتمنى من الله سبحانه وتعالى أن ينفع به، وهو أيضا مدرب معتمد لبرنامج مكافحة التدخين، لديه أكثر من شهادة في تخصصات طب المجتمع، الطب الوقائي، طب نمط الحياة، الوبائيات والتعليم الطبي، إضافة إلى عدة كورسات متقدمة من مدارس عالمية. نتمنى أن من الله سبحانه وتعالى أن ينفع به، ونترك له المجال ليبدأ بسم الله هذا الكورس. بروف عبد المحسن، الميكروفون عندك.
الله يعطيكم العافية محمود، جزاكم الله خير. السلام عليكم ورحمة الله وبركاته جميعا، حياكم الله في الكورس السابع. بداية أشكر جمعية وعي لاستضافة هذا الكورس، ونسأل الله عز وجل أن ينفع به وأن يكون كورس يعني حسب كما هي تطلعاتكم وكما هو طموحكم بإذن الله. وثانيا نشكر الدكتور محمود حقيقة على المقدمة الجميلة التي هي فوق ما استحق، لكن من حسن ظنه ومن فضله وذوقه الله يكرم. طيب، بإذن الله نبدأ على بركة الله. هذا الكورس السابع لسيرتيفايد توباكو تريتمنت سبيشالست كورس، وحبدأ بإذن الله بمقدمة عامة عن الكورس، إيش الفكرة منه، إيش فكرة السيرتيفايد توباكو تريتمنت سبيشالست، وبشكل عام إيش الأهداف اللي نطمح إنها تكون تغطى خلال الكورس، وإيش الأشياء اللي هي خارج السكوب of this specific course. So training outcomes اللي for this course is including multiple outcomes, including demonstrate understanding of the science behind tobacco addiction, withdrawal symptoms, and effective treatment for tobacco use. So we will focus on to understand the science behind the addiction and the science behind the effectiveness of treatment, or how the treatment works. And then provide clear and accurate information about the causes and consequences of tobacco use, to develop individualized treatment plans. So نهدف بإذن الله إنه by the end of the course everybody can develop an individualized treatment plans for their own patients. and then provide effective treatment for all forms of tobacco and nicotine use. As we know, we have a lot of tobacco products in the market, and nowadays even non-tobacco nicotine products in the market. So we aim to have a good idea of how to treat and how to provide effective treatment for each type of these tobacco products. The specific objectives, I will not go into the details of the specific objectives, but in brief, the course covers the core competences of tobacco treatment specialist اللي هي developed and recommended by the Association for Treatment of Tobacco Use and Dependence, ATTUD, for evidence-based tobacco treatment. ATTUD is an international organization اللي هدف منها إنه to work for standardizing the treatment of tobacco use around the world, treatment of tobacco use and dependence. And one of their products actually is to develop or developing the core competences of tobacco treatment specialist. هذه core competences of tobacco treatment specialist اللي developed by ATTUD أصبحت زي ال international standards لبرامج التدريب للمختصين في علاج التبغ، وهذه اللي احنا نهدف بإذن الله أنها تكون تغطت تماما في خلال ال4 أيام القادمة. وفي نفس الوقت هي اللي يعتمد عليها أصلا، يعني الاعتماد لهذا الكورس لهذا البرنامج تم بناء على إنه البرنامج يغطي كل هذه الأوبجكتيف. So we aim to cover all of the objectives in the ATTUD core competences tobacco treatment اللي هي all the known tobacco treatment training programs, especially in the United States, are following the same core competences. Is the course accredited؟ طبعا nationally من السعودي Commission for Health Sciences. هذه المرة يعني للأسف كانت 15 CME hours، عادة كانت around 25 CME hours، لكن يعني يبدو كان في تغييرات في الهيئة وفي طريقة الاعتماد الساعات. Internationally, the course is accredited from the Council for Tobacco Treatment Training Programs اللي هو اختصاره CTTP، وهذا هو الجهة اللي بتعطي اعتماد لبرامج التدريب على علاج التبغ في الولايات المتحدة الأمريكية أساساً. فكل البرامج اللي في اليونايتد ستيت هم they get accredited by this council. لكن في نفس الوقت this council also gives accreditation for tobacco treatment training programs outside of the United States. Currently, there are around 3 to 4 programs out of the United States. في الأردن there is a program في كينج حسين سنتر في هذا البرنامج اللي هو في جامعة طيبة، وأعتقد في برامج أخرى لاحقا كانت في الهند وفي دول أخرى لكن ما حضرني. طب إيش فائدة الانترناشونال accreditation for this program؟ إنه by completing this training you become eligible for the United States National Certificate and Certification Program اللي احنا نتكلم عليها في الدقائق القادمة. So anybody who want to submit للnational or request or apply for national certificate or certification program in the United States needs to complete a program that is accredited by the CTTP like this. طبعا البرامج اللي هي accredited من CTTP مجموعة من البرامج منظمة في اليونايتد ستيت، international واحد في الأردن وفي السعودية، وكما ذكرت في بعض البرامج أيضا حديثا يعني حصلت على الاعتماد سواء في الولايات المتحدة أو خارج الولايات المتحدة. Okay, so what will you get when you're attending this course regarding the certificates? فإن شاء الله إحنا نقول بإذن الله إنه الهدف الأساس هو إنه you get good training في موضوع tobacco assessment and treatment. لكن من ناحية الcertificates, if you attend the course, just attending the course, you will get a certificate of attendance مع CME hours. If you attend the course على الأقل 75% من الكورس and then pass the end of the course exam اللي هي عادة بيكون في آخر يوم في الكورس في نهاية آخر يوم في الكورس. هذه المرة كونها so sorry, I'm not sure if anybody is not talking Arabic, but I will try to stick to English. So this time, because the course is in the evening hours, so maybe some of you will be having full-time work and then come to the course in the evening. So at the end of the evening of the last day, maybe it's difficult to do the exam. So we will make a voting among you whether you want the exam to be at the end of the last day or to have it on like next Saturday. The end of the course exam, I don't want to give much focus on the exam. It's not our focus. Focus is on the training and getting the competences and getting the knowledge and skills. The exam usually almost all of the people who attend the course, the full course, and going with the material and the lecture we presented and practice, almost all of them pass the exam. But this is still a requirement that you attend the course 75%, pass the end of the course exam, and submit the required documents. And I will mention the documentation. So you will get, if you do these three, you will get the CTTS certificate, which is abbreviation for Certified Tobacco Treatment Specialist certificate, and become eligible to apply for the United States National Certificate and Certification. And number 4, to get free 6-month membership to a TUD, which is usually at the value of $45 United States. So what's the document mentioned here? The document is simple, just to satisfy the requirements of the accrediting body. So we'll get the certification application form. It's 1-page form that you will fill. Education licensure, if you have a license from the Saudi Commission, اللي هو بطاقة التسجيل, هذه enough. People who do not have license from the Saudi Commission of similar body, they can submit their education certificate, for example, PhD, or master, or bachelor. So, and then you need to submit case study assignment, 2 case studies, and experience hours. Again, 1-page form that state that you practiced smoking cessation practice signed by your supervisor. We will not double check. We will not go and check on you. This is a form that you fill yourself, and then your supervisor in the work setting will sign for you. Some of the attending colleagues already they have been working for a while in the smoking treatment and smoking cessation services, so those can submit immediately the experience form. If some of you, this is their first time and never worked with smoking cessation, they need to do some practice and to get less experience hours. So this is the application form, education certificate or license. Again, as I mentioned, 2 case study, there's a template that you will fill, and then the experience hours. So this is a summary. Attending the course, you will get certificate of attendance. 3 أشياء, all the 3 things will get certificate and become eligible and membership. And if somebody attend the course, pass the exam, submit the document, like still waiting for the experience hours form, they will get provisional CTTS certificate. الفرق بين هذه, the only difference between this one and this one is that the provisional will be for limited time for 2 years, and then once they complete the experience form, they will get the full certificate. So this is all what I have in the overview. If you have any question, please go ahead. Otherwise, we will proceed with the first lecture in this course, and we are together for the coming 4 days, inshallah, and we hope everybody will be satisfied and very content that would be presented, inshallah. Anybody have any question? Okay, then Bismillah, now we proceed with the first lecture in this course, Bismillah, would be with Dr. Abdullah Mayouf, Dr. Abdullah, National Guard Riyadh, Assistant Professor in Respiratory Therapy and Certified Tobacco Treatment Specialist. Dr. Abdullah will present tobacco use globally and in Saudi Arabia, and also will present tobacco use impact on health. Dr. Abdullah.
السلام عليكم ورحمة الله، مساكم الله بالخير جميعا. بس الزملاء إذا أقدر أسوي شير للكونتنت تعطيني برميشن، الله يسعدك.
معك الشير يا فندم، تفضل.
تقدر. Yeah.
Visible now, I think I can. Thank you Prof. عبد المحسن, thank you دكتور محمود, كذلك الزملاء, thank you for your facilitation this course. For the attendees, يعني أتمنى لكم تجربة إن شاء الله علمية ممتعة مفيدة مع الزملاء والخبراء والإكسبرت. بإذن الله تكون يعني أيام يعني fruitful of discussion and dynamic learning experience. I am Dr. Abdullah Mayouf Al-Anizi, as Prof. Abdul Mahsen mentioned. I will present 2 topics. I will try my best and inshallah finish before most of your صلاة المغرب inshallah. The content before was presented by Prof. Abdul Mahsen, so most of the content were prepared by Prof. Abdul Mahsen. I will be presenting some part of it with some. I will be presenting the presentation with some modifications. We will talk about tobacco use in general, some statistics, and also the impact of tobacco on health. I will also try to link it with the upcoming lectures. For example, why do we need to know such information? Why it's relevant? How we can convince patients or policymakers about those information. I'm quite sure all of the information that will be presented now, I think all of you know it. You know the danger of tobacco, how does it impact our health, plus how prevalent tobacco. However, we have to present the numbers just to support ourselves with evidence-based statistics and evidence-based studies that link tobacco to diseases or the prevalence of tobacco. So without further ado, again, as I mentioned that we know tobacco is prevalent and we know tobacco is dangerous. Just statistics like tobacco use kills more people every day than 24 jet crashes. Here, the irony that we know that tobacco is dangerous. We know that there are a lot of mortality and morbidity associated with tobacco use. However, if we hear about in the news that there is a jet crash, you see the breaking news, how people are panicking. However, we don't really subconsciously or consciously recognize how dangerous is tobacco on the economy, on the health and the quality of life, on our healthcare system. So this is just to give you a message that sometimes we have more lethal weapons around us, even it's embedded in our culture that we don't really emphasize on, especially from policymakers, from the community in general. One of them are sedentary behaviors. The most dangerous sedentary behavior is smoking and tobacco use. To the worldwide